It is a Friday afternoon. James, 64, is at his desk in Bedok, finishing the last project of his career. 9 months from now, he turns 65. He has been looking forward to this for 11 years. His CPF Life is set up. His HDB is fully paid. His retirement account has $218,000 in it. He has built this carefully, deliberately, over 3 decades. He feels ready. There is one account he has never thought carefully about. Not because it is small. It has $71,000 in it. Not because it is unimportant. It pays his health insurance automatically every year without him doing anything. He has never thought carefully about it because it just works. That account is his MediSave. What he does not know, what almost no Singaporean thinks about before their 65th birthday, is that MediSave stops being a background account at 65. The premiums it covers start rising. The ISP cash bills he has never paid before start arriving. The cap on the account locks permanently, and the decisions he made about health insurance at 43 will determine his out-of-pocket costs in his 70s. None of this is in his planning spreadsheet. All of it arrives on schedule. Start with the number most people have never seen laid out in one place. MediShield Life, Singapore's mandatory health insurance for every citizen, and PR, charges premiums based on your age. Not once when you enroll, every year, rising every time you move into a new age band. Here is the official CPF Board premium schedule, effective from the 1st of April 2025. At age 60 to 65, 903 Singapore dollars per year. At age 66 to 70, $1,326. At age 71 to 73, $1,643. At age 76 to 78, $2,027. At age 81 to 83, $2,303. At age 84 to 85, $2,616. From 60 to 85, the premium nearly triples, $903 to $2,616. James's CPF Life payout on the standard plan, $1,780 per month. Fixed. Forever. It will not triple, it will not double, it will not grow at all. At 84, his MediShield Life premium alone, the mandatory coverage he cannot opt out of, will consume more than 1 full month of his CPF Life income per year. He had no idea. It was never on the spreadsheet. And that is before the reviews. MediShield Life premiums are reviewed every 3 years. The last review in 2024 raised premiums by up to 35%, phased over 3 years to March 2028. That increase is already baked into the numbers above. The next review, 2027. James is 64. Over 20 years of retirement, there will be 6 or 7 premium reviews. Each one responds to Singapore's aging population and rising healthcare costs. The direction over 20 years is not ambiguous. He has been planning on MediShield Life costing what it costs today. It will not. Now, the mechanism inside MediSave that almost no one understands until it is too late. MediSave has a ceiling, the basic healthcare sum. In 2026, it is 79,000 Singapore dollars. For anyone below 65, this ceiling rises every single year, tracking healthcare cost growth. The day you turn 65, it freezes, permanently. Whatever the BHS is on your 65th birthday is your personal BHS for the rest of your life. The schedule shows exactly what this means for each cohort. Those who turned 65 in 2016 have a lifetime BHS of 49,800. Those who turned 65 in 2023, 68,500. Those who turned 65 in 2026, 79,000. James turns 65 in 2027. His BHS will lock at approximately 81 to 83,000, the likely figure for that cohort based on the current annual trajectory. fixed, for the next 22 years. His premiums will not be fixed. His frozen BHS will slowly become a tighter and tighter ceiling relative to the rising cost of the coverage it needs to fund. MediSave earns 4% per year, the same guaranteed rate as the retirement account. That compounding is real, and it helps, but it runs against a drain that rises with every premium review. The race between growth and drain is the financial reality of MediSave in retirement. Most Singaporeans have never run the numbers. Here is where it gets expensive, in a way James never saw coming. He has had an integrated shield plan for 21 years. He chose it at 43, Class A ward, public hospital, when the premium was manageable and the cash component barely existed. He has never changed it. He has never needed to think about it. At 64, his ISP annual premium is approximately $2,164. MediSave pays part of it automatically. He assumed MediSave covered most of it. It covers $600. That is the additional withdrawal limit, the annual cap on how much MediSave can pay toward an ISP, covering both the MediShield Life base premium and the insurer's additional portion combined. $600 per year for ages 41 to 70, $900 per year from age 71, $2,164 minus 600, $1,564 per year in cash from his bank account. Not from MediSave, not from CPF Life, from the money he budgeted for food and transport and family dinners. James did not know this. When he chose the Class A ISP at 43, the cash component was small. Nobody told him that by 65, the premium would be over $2,000 and MediSave would cover less than a third of it. He found out on a Friday afternoon in Bedok, when he opened his insurer's renewal notice and read the payment breakdown for the first time properly. His planned monthly surplus in retirement? Approximately $250 after all living expenses on a paid-off HDB. The ISP cash component alone, $130 per month. His surplus is now $120, before any hospitalization, before the ISP rider. The rider, the add-on that covers his deductible and co-insurance when he is admitted, must be paid entirely in cash. MediSave cannot pay a single dollar of rider premiums. That is an MOH rule that has been in force since 2021. James's rider adds another $480 per year in cash. His surplus is now in negative territory before he has paid for a single medical event. Wei Liang is 71. He has lived in Tampines for 34 years. He retired from Keppel at 65 on the full retirement sum CPF Life, $1,780 per month. Modest but manageable in a flat that has been paid off since 2014. He bought his ISP rider in 2017 at 52. At the time, routine, affordable, one of those things you set up and forget. On the 27th of November 2025, a deadline passed that most Singaporeans missed. MOH changed the rules for all ISP riders issued after that date. New riders from the 1st of April 2026 cannot cover the annual deductible, $3,500 per hospitalization at private hospital or Class A ward. The co-payment cap doubled from $3,000 to $6,000 per year. In exchange, new rider premiums fell about 30%. Wei Liang's rider was bought in 2017. He is grandfathered. Until his first renewal after the 1st of April 2028, his deductible remains covered by the rider and his co-payment cap stays at $3,000. He does not need to do anything. He must do one thing, not switch. The moment he moves to a new rider, for any reason, on any insurer, he loses the grandfathered terms permanently. He is 71. He will be 73 at the 2028 renewal. His health history at that point will determine his options. His neighbor Marcus bought a new rider in February 2026, 2 months before the deadline, but after the cutoff date. He is on the new structure. 1 hospitalization, $3,500 out of pocket before the rider activates. If his stay generates a bill that pushes through the $6,000 co-payment cap, he pays that too. Maximum out of pocket in a single year, $9,500, before his ISP base premium. Before his cash rider premium. Marcus earns $2,300 from part-time consulting. He is 68. $9,500 in a single year against the $2,300 monthly income. That is not a theoretical risk. That is a coin flip event. 1 in 2 Singaporeans 65 and above will face severe disability at some point in their lifetime, arriving with a financial consequence that was never in the plan. Wei Liang reads the grandfathering rules on the CPF website that evening. He does not switch anything. He writes the April 2028 renewal date on his calendar. In Clementi, Priya is 60. She is watching this video on a Wednesday evening after dinner because a colleague mentioned it at the office. She works as a senior operations manager at a logistics company in Tuas. Her MediSave balance? $44,000. She has 5 years before 65. 5 years before her BHS locks. 5 years to close a $35,000 gap between where she is and the BHS. Her CPF contributions flow into MediSave automatically based on her salary, approximately $5,000 to $6,500 per year, given her income and age band. In 5 years, natural contributions will add roughly $25,000 to $32,000. She will arrive at 65 with a MediSave balance of approximately $69,000 to $76,000, below whatever BHS her cohort locks at, meaning her ceiling locks lower than it needs to be for 20 years of rising premiums. Her path: voluntary cash top-ups to MediSave before 65. Up to $8,000 per year qualifies for income tax relief from IRAS. At her marginal tax rate of 15%, $8,000 in top-ups saves $1,200 in tax the same year she contributes. The top-up earns 4% compounding. The tax saving is immediate. She is 60, she has 5 years. $8,000 per year. $40,000 topped up, $6,000 in tax savings recovered, the balance compounding at 4% until 65. She arrives with a meaningfully larger BHS locked ceiling. The difference is not dramatic in year 1. It is significant across 22 years of retirement when premiums are drawing from it. She opens her CPF app. She checks her MediSave balance for the first time this year, $44,000. She goes to the top-up function. She sets a reminder to process $8,000 before the 31st of December. Now the part that costs Singaporeans money every year because they do not know it exists. James has had mild hypertension for 4 years. He manages it at a GP clinic near his office in Bedok. Monthly visit, medication, blood pressure monitoring. He pays the bill at the counter each time, cash or pay now, about $28 per visit. 12 visits a year, approximately $340 annually. His clinic is CDMP accredited. The Chronic Disease Management Program, 23 approved chronic conditions including hypertension, diabetes, high cholesterol, and asthma, allows MediSave to cover outpatient treatment at accredited polyclinics, CHAS-GP clinics, and specialist outpatient clinics. Current limit for a single CDMP condition, $500 per year. For 2 or more conditions, $700. From the 1st of January 2027, Budget 2026 raises these to $700 and $1,000 respectively. James qualifies. He has been paying $340 per year in cash for 4 years. That is $1,360 he paid out of his bank account that his MediSave would have covered if he had known to activate CDMP billing at his clinic. Less than 15% of CDMP patients reach the annual limit. Most qualify, visit regularly, and pay in cash because they never confirmed their clinic was accredited or never asked to route the bill through MediSave. Additionally, Flexi MediSave. For anyone 60 and above, James qualifies in 9 months, $400 per year from MediSave for any approved outpatient visit at polyclinics, public SOCs, and CHAS GP clinics. Separate from and additive to the CDMP limit, both usable in the same year. From the 1st of January 2026, outpatient imaging, MRI, CT, ultrasound, has a $600 annual MediSave limit, doubled from $300. James calls his GP clinic on Monday. One question: are you CDMP accredited for hypertension? The answer is yes. He asks them to route future bills through MediSave under CDMP. The next visit, he pays nothing at the counter. Friday evening, Bedok. James closes his work laptop and opens the CPF app for the first time in 8 months. He has checked his ordinary account dozens of times over 31 years. He has checked his retirement account every few months since 55. His MediSave, approximately 3 times in the last decade, each time when a hospitalization was processed and he wanted to see the deduction. Tonight he reads the MediSave screen properly. $71,000, 4% per year. BHS locks in 2027 at approximately 81 to 83,000. He can check the exact cohort figure when it is announced. ISP premium for next year, 2,164. MediSave covers 600. Cash required, 1,564. Rider, 480 in cash. CDMP, not yet activated for his hypertension. He's looking at a healthcare endowment, not a passive account. $71,000 compounding at 4%, drawing against premiums that will grow with every review for the next 20 years. His MediSave will likely outlast his retirement if he does not have a catastrophic health event, but it will outlast his retirement more comfortably if he acts tonight rather than in 9 months. He does 3 things. First, he sets a reminder to call his GP on Monday morning and activate CDMP billing. $340 per year back into his pocket starting next month. Second, he opens the voluntary top-up function. He is 64. 1 year of 4% compounding on a top-up is modest, but it raises his BHS locked starting balance permanently. His marginal tax rate is 7%. 8,000 in top-ups saves 560 in tax this year under IRAS relief. He makes the transfer. He files the tax relief claim before the 31st of December. Third, he checks his ISP rider purchase date, 2015, grandfathered. He writes April 2028 on his calendar. He will not switch before then. He is not panicking. He is not rewriting his retirement plan. He is closing 3 gaps that have been open for years. Gaps that were always predictable, that nobody warned him about, and that will cost him nothing to close tonight. It will cover most things. The parts it does not cover are predictable. And predictable means plannable. MediSave is the account every Singaporean treats as the most boring part of CPF. It runs in the background. It pays premiums automatically. It handles itself. Until 65. When the premiums start rising faster than your fixed CPF Life income. When the ISP cash component appears on your monthly budget for the first time. When the BHS locks permanently. When the rider decision you made at 43 determines whether a hospitalization at 70 costs you $3,000 or $9,000. None of this arrives without warning. The warning is this video. James had 9 months. He used 3 of them doing nothing and 6 of them not knowing. On a Friday evening in Bedok, he found out. and did 3 things in 40 minutes that changed the financial trajectory of his MediSave for the next 22 years. What does your MediSave balance show right now? Open the CPF app tonight, 30 seconds. Then check if your GP clinic is CDMP accredited. Then check the dates on your ISP rider. 3 questions. The answers determine whether you are managing your MediSave or letting it manage itself. Next video, why most Singaporeans with an SRS account are using it in the most expensive way possible, and the one withdrawal sequence that saves $40,000 in tax they did not know they owed.